In this lecture, we'll be discussing some of the therapeutic interventions associated with behavior therapy. Now, there are quite a number of interventions associated with this type of therapy, and in this lecture, we're just going to talk about a few of them. There's a more exhaustive list of interventions in your book, but even your book doesn't cover all of the interventions associated with behavior therapy. Now, the good thing about the interventions associated with this theoretical orientation is that these interventions are empirically validated, meaning they're supported by research. So since there is such a focus on behavior change and measurable behavior change with this theory, we know that these interventions do in fact cause significant, appreciable, measurable changes in behavior. So the first intervention that we'll discuss is applied behavior analysis. And this intervention applies operant conditioning principles to behavior change. So remember, operant conditioning has to do with the consequences of a behavior influencing how likely that behavior is to occur in the future. So if the behavior is followed by reinforcement, it's more likely to happen or more likely to continue to happen in the future. And if it's followed by punishment, the behavior is likely to decrease or go away altogether. So reinforcement can be used in behavior change in a number of ways. You take a behavior that you would like to increase and follow that behavior with something that you find desirable that's likely to increase the behavior. So maybe if your client exercises 5 days out of the week, they choose a reinforcer like getting their nails done or having a night out with friends. It can be something like if you want to increase the amount that you eat at home, every meal that you eat at home or prepare yourself, you take the money that you would have spent eating out, put it in a jar, save it, and then at the end of the month, you use all the money that you save from not eating out and buy yourself something. So that's likely to increase the behavior of eating at home. Of course, punishment is used in a number of ways. It could be something like you're trying to stop cursing and you wear a rubber band on your wrist, and every time you say a curse word, you snap your wrist with a rubber band. So in theory, that should decrease the amount that you curse. Or maybe you put, $5 in a jar or move it to a different account, where you're punishing yourself by losing money for every time that you curse, and that should decrease the amount of cursing you do. There is an intervention that is used for people with alcoholism where they take a medication on a daily basis, and if they drink alcohol while they've taken this medication, they get sick. So getting sick is punishing the behavior of drinking alcohol, which should then decrease the behavior. So in addition to reinforcement and punishment being used with applied behavior analysis, they also incorporate operant extinction. And operant extinction is based on the idea that you can decrease a behavior by removing or withholding the reinforcement that typically follows that behavior. So let's say you have a client who's a parent and their child tends to tantrum when they take them to the store. You analyze that behavior and you realize that typically when the child tantrums, the parent sort of quiets them down by buying them a small toy or some type of candy or treat at the store. And you realize that the candy or the treat is actually reinforcing or increasing the behavior of tantruming when out at the store. So if you were to employ operant extinction, you would tell the parent, when your child tantrums at the store, do not buy them candy, do not buy them any type of treat. And over time, the behavior should become extinct, meaning it should become partially extinct, meaning it decreases, or it may extinguish altogether, meaning the behavior no longer occurs. So another behavioral treatment is systematic desensitization. And this is a treatment for fears and phobias, and it's based on classical conditioning. So here you pair an anxiety-producing stimulus with some form of relaxation. And so this is based on the idea of counter-conditioning, meaning two opposing reactions cannot exist at the same time. So when you're beginning this treatment, the first thing you want to do is teach your client some type of relaxation method. It can be some type of hypnosis. It can be just visualizing a calming location. It can be deep breathing or some type of muscle relaxation. But the first thing you do is instruct them and train them in some way to keep themselves relaxed and calm. Next, you develop a fear hierarchy. So this is a list from their least fear-provoking stimulus to their most fear-provoking stimulus. So let's say their ultimate fear is having a spider on their body. So when making your fear hierarchy, you may start with their least fear-inducing stimulus, which might be looking at a picture of a spider, say a still picture on a computer screen or in a book or a magazine. The next level, which will represent something that causes them more fear, might be seeing a spider moving on TV or on the computer. Their next level might be having a spider in the same room in a closed container that is far from them. Next, it might be having a spider in an enclosed container that's close to them. Their next level might be having a spider loose in the room but is far from them. Next level might be having a spider loose close to them. And then their ultimate fear might be having the spider on their body. So now you've made the fear hierarchy, and then you want to pair the relaxation with the fear-inducing stimuli. So you'll have them go into a relaxed state using whatever method you taught them to calm themselves. Once they're calm and relaxed, you introduce that lowest level of the hierarchy. So you show them the still picture of the spider. And then if they become upset, you instruct them in the relaxation method until they're calm, until they're at the state where they can look at the picture of the spider and remain calm. Because again, going back to counter conditioning, two opposing reactions, so fear and relaxation, cannot exist at the same time. So you pair those things together until they're able to remain relaxed while looking at the picture of the spider. And then you increase the level, meaning you go to the next level of their hierarchy where they're looking at the spider that's moving on a TV screen, computer screen, and still maintaining their relaxation. So you do this until you reach the highest level of their hierarchy where they're able to remain relaxed while having a spider on their body. So another treatment for fears and phobias and other negative emotional responses would be exposure and flooding. These are also based on classical conditioning, and rather than being based on counter conditioning where you're pairing two opposing reactions, these two types of interventions are based solely on classical extinction. So we talked earlier about operant extinction, but here we're talking about classical extinction. So from the perspective of classical conditioning, extinction occurs when you present the CS, the thing that is feared, without the US, which is the thing that originally created the fear, the thing that was originally paired with the neutral stimulus to cause the fear. So for example, let's say you had no fear of driving until you were rear-ended, which caused fear. Now whenever you drive, you feel fear. So now driving has become a conditioned stimulus that produces the conditioned response of fear. And the reason that you fear driving is because since driving was once paired with being rear-ended is the unconditioned stimulus, now you expect that when you drive, you will be rear-ended, which causes you to feel fear when you drive. The only way to extinguish that fear is to present the CS, meaning driving, without the US, being rear-ended. So the way that you would get over your fear of driving is to drive, be exposed to what you fear, being exposed to driving long enough and often enough without being rear-ended that that association is broken and driving no longer causes the conditioned response of fear. And so this is just what exposure and flooding consist of. So you would expose the client under carefully controlled conditions to the situations that produce the fears and negative emotions. So if your client fears driving, you have your client drive. If your client fears eating a particular food, you have them eat the food that they fear. Maybe they're afraid of a certain animal because they expect to be bitten or mauled. You expose them to that animal in a very carefully controlled situation until they realize that this animal is not going to hurt me, and they lose that conditioned response of feeling fear when presented with that animal. Now, flooding is very similar. Well, flooding is a form of exposure, but the difference between exposure in general and flooding is that flooding is an intense and prolonged exposure to the anxiety-producing stimuli. So whereas exposure can be graded, maybe you start at a low level of exposure and increase the exposure, or maybe there's short periods of exposure, or you expose your client, for a few minutes in every session to the thing they fear. Flooding is intense and prolonged. So flooding takes one session. So whatever your client's fear is, your client fears having a spider on their body, you put a spider on their body within the session and wait for them to see that this spider is not going to hurt me, and then they naturally calm down. So flooding is a very intense form of exposure. And the difference, I did say that exposure can be graded, meaning that you start at a low level and increase the level. The reason that differs from systematic desensitization is that it's not paired with relaxation. So even if exposure is graded and increases over time, it's still exposure and not systematic desensitization if you don't also introduce that element of teaching the client to calm themselves. So another intervention from the behavioral perspective is eye movement desensitization and reprocessing, also known as EMDR. This again is a form of exposure therapy, and it's a treatment for clients who have some type of traumatic injuries. So it entails assessment, sort of a base level measurement of behaviors, preparation, you're preparing them for the intervention, and then you have them engage in imaginal flooding. So they're thinking back to these traumatic memories in their mind. They're not physically being exposed to their traumatic situation, of course, but they're just um, remembering what it is that causes them to have these symptoms. And then while they're engaged in thinking about their traumatic memory, you're doing cognitive restructuring, meaning you're having them think about the situation in a different way. And we'll go more into cognitive restructuring when we have our next chapter on cognitive behavioral therapy, but it involves changing your perceptions of events. Now, during this process where they're revisiting these memories, the clients engage in these lateral eye movements. So there's a certain way that they're asked to move their eyes back and forth. But some research suggests that this is not, an essential component of the treatment, that the treatment is effective even if the client doesn't engage in these lateral eye movements. And finally, social skills training. This helps clients develop and achieve skills in interpersonal competence. So you're actually teaching them social skills, teaching them how to behave in social situations. It involves behavioral techniques like psychoeducation. So you're actually educating them about, you can educate them about social phobias. You can educate them about ways to cope with it. So you're giving them some type of information. You would also engage in modeling. So either you will display the social skills that they're trying to develop, or they'll watch somebody else display those social skills. They'll engage in behavioral rehearsal. So within the therapy session, they're going to rehearse the behaviors, and then the therapist will give them feedback on how well they're performing the skills that they learned. And then, of course, they'll take those skills that they learned within the session and apply them to situations outside of the session. So the idea is that if clients can correct their problematic behaviors in practice sessions, they can then apply the new skills in their daily lives.